This show is sponsored by Horizon HVAC, who you can count on for all of your heating and cooling needs. Also by CES Construction, who specializes in bathroom and kitchen remodels. Here we are, Mindset Radio Podcast, episode 13 with TheCombatChiro. Dr. Mike, I'm sorry.
It's okay.
Welcome. Thank you for coming.
Yep, thank you.
Very interesting topic for us to cover today. I'm loaded with injuries. Sheena has her own injuries. And this is a field that I don't know much about that I would love to dive into. And you're the man to talk to.
Yeah.
I want to start off with how you got into wanting to get into chiropractic care.
I got into chiropractic care. I was obsessed with anatomy. And then I actually wanted to be a pediatrician and work with kids. But a pediatrician actually deterred me from it. So then I just got into sports injuries and I got really good at treating them. It's one of those things where it just comes to you naturally and you just get better at it. And then you start pairing it with the different modalities that I do and understanding acute and chronic pain and how different people respond to pain and different stimuluses, depending on what you do for the injury. That it just fascinated me from probably high school anatomy till end of my senior year of college.
Yeah.
So I was originally going to go to PT school, and then I shadowed a chiropractor. That's a funny story of how I got into that as well. And then sure enough, I just fell in love with it.
What was the story? Let's hear the story.
A friend of mine who I no longer talk to, he needed rehab. So me and my best friend, we went with him and his mom, and we admitted him over at Butler. Now the mom's best friend came, and she just so happened to be a manager of a chiropractic office. And we were all graduating at the time. And I told her how I was applying to PT schools. And she said for the summer, she goes, why don't you hold off on PT school, shadow the summer, and really decided if this is something you want to do. You either want to go to PT or try chiropractic. So after that shadowing experience, I applied, and immediately I applied to chiropractic school and I got in.
No kidding.
Yeah.
And you loved it right away?
I loved it right away, man.
I see. So it's funny because I feel like this topic has kind of gone viral over the last year.
Yeah.
Because of that TikTok thing that they're doing, even on Instagram, where they're throwing the mannequins off of bridges and they're breaking the backs. Have you seen that stuff?
The parody videos
are hilarious.
They're so great.
I love it. So you went to LaSalle High School. Mm-hmm. We were just talking. You guys had a really good football team and gave me my first concussion in 2003, running up the middle. And then you went to New York for college, correct?
Correct. Manhattan College.
What made you come back to Rhode Island, and why didn't you want to stay out there? I feel like there's more opportunity out there for this type of thing. And
oddly enough, the scope of practice in Rhode Island is actually better than New York's.
Huh.
So in New York, chiropractors can't dry needle, which is something that's really big in my office. I do a lot of dry needling. Essentially,
what that acupuncture?
I use acupuncture needles, but acupuncture is different in where it's based off of chi and energy healing, and different systems. Whereas when it comes to dry needling, I'm diagnosing a musculoskeletal disorder. So if there's something muscular, ligamentous, tendinous, potentially joint related, I diagnose it as that, and I try to stimulate that area with using the needle. So I don't base it on any energy systems whatsoever. Just on my diagnosis, let's say your upper trap and you're getting tension headaches. I'll throw 2 in the upper trap in hopes that it'll stimulate those muscle fibers, cause a central nervous system response, and help that area.
Now, is it similar to an acupuncture needle?
It's exactly an acupuncture
needle.
So yep.
So if I have...
The needles are no different.
Okay. So if I have stiffness in my neck, you have ways where you have spots that you can put those needles to relieve the... How does that work? Because I've had acupuncture done before, and I've had it done in my ear. It was for a full body detox.
Okay.
And I have to be honest. We did this meditation. I sat back and kind of just closed my eyes, and it felt like I started dreaming. I did go into some type of different state than I was at the time. What causes that? I don't understand how that anatomy works, because I feel like they're just small little things that are entering your skin. Explain how that works.
The way that feeling that you probably had, it stimulated your central nervous system. And there's another one as well. It's called your autonomic nervous system, which has 2, parasympathetic and sympathetic.
Yeah.
It gets kind of nerdy.
Yeah.
But one's a fight or flight response and the other one's a rest and relaxation response. Probably what you had is there's different points in the body. have you ever seen like any Taekwondo videos or like,
yeah, of course. Yeah.
yeah, like with Bruce Lee, where like he hits like a certain spot and
Yeah.
knocks the guy
He
out.
does like, yeah.
There's different pressure points on your body. So the one that they were probably trying to do in your ear relates to that energy system that acupuncture focuses on.
Huh.
I'm unfamiliar with all of those different pressure points, but
Yeah, it worked.
yeah,
I mean, it worked. I was
it
actually,
stimulated the right thing.
yeah, it was actually, I was in rehab I was on opiates for quite some time, and I had my stints of going in and out of rehabs to try to get off of Percocet. And that was one of the methods that they use. They use acupuncture, and it was just kind of one of those things where it was like, all right, I want to get out of here for a minute. I'm going to go just try it out just to get out of this area that I was in. And I fell in love with it, man. And I've been meaning to go back and do more. And yeah, it's very interesting. I never would have thought it would have done something, to be honest with you.
Which side topic? I don't mean to put it on you, but I'm really proud of you for doing that.
Thank you, man.
I have a lot of patients that suffered from opiate addictions, whatnot,
Yeah,
and
yeah.
friends and whatnot.
It's a
that have
battle,
been
dude.
in and out of rehab, and
Yeah.
for you to persevere and be as successful as you are right now, you should be very, very proud
Thank
of
you.
yourself.
I appreciate that.
Yeah.
Really, it was, I came with a lot of help, a lot of support, especially from Sheena. I mean, she's been amazing.
It's an emotional topic.
Yeah,
but
it's
it makes
emotional.
me-
An empowering one.
It makes me very, very happy.
Yeah. But it's real life. I haven't really yet dove into that whole story, and I'm going to at some point when the whatever, it's not like I'm waiting for a time or anything to do it. If I'm able to help somebody in a need of help or a need of time, then I'm all for it, man. So eventually I'm going to go more into my story and try to help people that are going through that shit, because it can be a lonely road, dude.
That video you put out the other day on your Instagram made me want to run through a brick wall.
Yeah. Yeah.
Even that like little one, I'm like, God, that's freaking
Yeah.
amazing.
I did that on the fly, man. I just I was like,
Yeah.
should I post this? Should I not? Because it's you put yourself in a vulnerable position when
Yeah.
you do stuff like that,
Yeah.
and,
You do.
and not everybody understands.
Mm-mm.
People take it differently, and but it brings me to a topic that I would like to talk to you about how to relieve pain in different types of ways.
Sure.
Rotator cuff injuries are very common. The sports world, boxing, and quite frankly, in the workforce. I mean, anybody that's does labor or any type of sports related injuries usually has to do with the rotator cuff. Do you absolutely need surgery to recover from a rotator cuff injury?
Not necessarily. I'm gonna like scale it back and like puzzle it together at the end. But when it comes to rotator cuff injuries, you got to scale it down to the severity, depending on the muscle and depending on the grade of the injury, right? So if someone has a complete tear, would you say someone needs surgery or doesn't need surgery? I'm gonna answer it for you. Not necessarily, and it's always like it depends kind of answer.
Yeah, I would think they would. Like if I heard complete tear, I'd be like, oh, they got to go through surgery.
I have some patients that have complete tears and they never went through surgery.
Hmm.
They just focused on strengthening the complementary muscles that surround that area, and those muscles were able to get strong enough to sort of mimic the action of the torn muscle.
So what if the cartilage is like completely gone and it's just bone to bone?
I mean, that's where you start getting into shoulder replacements and like
There's no rebuilding that.
sadly not. There's no rebuilding that. Probably the best thing to do would be being very diligent in a rehab / physical therapy setting. Find a good physical therapist that can actually help you with those rehabilitatory exercises, the ones that really challenge you, especially if it's bone on bone. You want to almost lubricate the joint itself. It's not going to recreate any cartilage.
How do you do that?
By movement.
Yeah.
So, like it goes the saying, movement is medicine. That's
yeah,
exactly
yeah,
it.
Yeah.
If
If you
something
don't
is-
use it, you lose
yeah.
it kind of thing.
And the thing is, you have some people where it's bone on bone and they don't feel any pain. And then I have other people where it's a perfectly normal shoulder on MRI or X-ray, and they're the ones having the most pain.
Yeah.
Same thing with lower back injuries. I have some people with 3 herniated discs, and I mean, there's 3 levels of protrusions. You have a bulge, you have a protrusion, and an extrusion. A bulge is just a regular little semi-lunar circle.
Mhm.
Protrusion, a little bit more expanding. And then an extrusion literally looks like, when you're like blowing bubbles and it's like bubbling
Yeah.
just before it's about to pop
Yep,
off and form
yep,
a circle.
Yep.
It literally looks like that, and it's
In their back.
and it's abutting the entire spinal canal.
But
they have
can you
full-
see it through the skin?
No, that's
So
that
you
would
have
be
to see it
from
internally.
MRI.
Gotcha. But that's how you identify whether it's a bulge or
Yeah.
yeah.
MRI is the best way to determine when it comes to soft tissue injuries, ligament, muscle, disc bulges, that'll show up on MRI. X-ray is best for scanning bone density and if there is any like structural anomalies.
Yeah. When you started Strive, was it strictly for chiropractic care, or did you have in mind to do other things as well?
So now I'm sort of getting into what would you call it? Sort of like recovery center.
Yeah.
So I really want to start getting into the red light therapy, the cold plunges, the
Yes,
sauna. Like,
please do. Please do.
Yeah, anything that can.
Are you a Brecca guy?
I do love Brecca.
Brecca's awesome.
Yeah,
great.
Yeah.
Look, some of his stuff is a little outlandish, and I'm like,
it's salesy.
I'm like, Gary,
It's
come
salesy.
on. And
Yeah,
then other stuff, I'm just like, I love it.
Yeah. Yeah. What he's doing is incredible.
Yeah.
We do the 30-30-30. So it's 30 minutes of cardio, 30 grams of protein within 30 minutes of waking up. And when you do the cardio, you have to keep your heart rate under 110. So it's a slow state cardio.
So was that zone 2?
Yeah, walking.
Okay.
Just basic walking.
Zone
But
1 then.
it's the most efficient way to burn fat that he knows of. And
how's that going?
when we did it, we didn't stick with it for longer than maybe we did it for about 2 months.
Weeks. I think we did 2 weeks and then we started implementing other things. Like then we started doing the cold plunge and this and that.
Which we usually
were
do.
Just dabbling in each of his things that he was saying. But for those 2 weeks, other than getting up super early and doing it, after 2 weeks, we were already in the habit of getting up after. So we wake up, we go do that cardio. And then as soon as we finish the cardio, then we ate. So you're doing it all within an hour and a half.
How was like your mental and cognitive state? Because I have people where they're like, I've never felt sharper.
Yeah.
And then you have other people where they're feeling very sluggish.
I felt good.
Yeah.
I felt really good. Around that time, and it was winter time too, and it was dark. I'm not a winter guy. I don't mind the weather. The thing that gets me in the winter is the freaking light. Like when it gets dark at 4:35, man, it's tough to get through some of those days. So for that was really working, and that worked well. Gave me a lot more energy. A lot of the things that he did that we implemented gave me a ton of energy. That's what I did notice. Some of the fasting, like when I fast, I have so much energy.
Same.
I actually would preferably fast, but I just love food so much that I just don't.
It's difficult.
It's so hard to do. But like, it sucks because like, I know that if I do it, how good I'll feel, but I just don't do it. And, we end up trying to do these stupid diets where it's just like, okay.
Not like diet fads, but we are going through phases of changing the way we eat. So like we did the carnivore diet, to see how we felt on that, which
we felt great.
We felt great up until a point when
it's
he was getting too much. Yeah, he had too much iron, which was causing headaches. So what we do is we're trying all of these different ways, different methods, and seeing what works for us.
Sure.
And then altering it to fit into our lifestyle, the things that we love about it the most. It's kind of like anything. Yeah. You're open to listen to anything, and then you implement what works best for you and your family, which is awesome.
I like that you said that. Yeah, because I've safely tried every diet that I know. I'm like, is it going to work? Is this a fad? I'm going to try it anyways. Yeah. Because at the end of the day, how can I tell my patient, don't do it, if I've never done it myself?
Exactly.
Which, one thing, I hate being a hypocrite. So I'm always going to do something before I recommend it.
Yep.
And one thing I found was I've tried all these diets and I'm like, okay, I like this aspect. I like that aspect. And then you kind of just bundle it together and just come up with nutritious meals that end up being great in macros and micros and whatever you want to call it. Yeah. And you just find your way. And you're like, you know what? I like eating this. This makes me feel good. I like when I eat this before a workout. I like when I eat this after a workout, and it comes together.
And ultimately you're learning. So you're still growing, and it's not a failure if you don't do it for the rest of your life. Like I tried being vegetarian, and I love vegetables and I love fruit and everything, but I also love fish and I also love chicken. And so it's really just ultimately like we were saying,
I lied to you guys.
Yeah,
I said I've tried every diet. That's the one thing I can never do is be a vegetarian. I lied.
A vegetarian?
I can't, man.
My friend Jared is on that, and he's trying to get us to go there. And I love meat way too much.
Probably the lowest I would go, and not even to say it's low, but I'd probably become like a pescatarian.
Yeah,
like I'd have to have
keep
some
the
sort of
fish in
fish.
there. Yeah.
You're a big fish guy?
I'll eat anything, but like I'd have to have some type of protein.
Yeah.
I thought it was going to be the same way too, because I grew up in California off of taco buses with the burritos that were 12 inches, just huge. So I was like, me take meat out? No way. But the recipes are just phenomenal. You can find vegetables that actually taste like meat. So it wasn't as bad as I thought it was going to be too. I'm
Sounds like too much work.
it's really not.
I
It's a
saw a guy that made like a
lifestyle.
steak mushroom the other day. I'm not gonna. It
Mm.
looked pretty good, but
Yeah.
I saw that.
It's
just out of spite, I'm like, no.
Yeah.
yeah.
You saw the other day a freaking 3D printed steak.
Oh, yes. This is scary.
Ash,
come
see if
on.
you can find that. It was like a ribeye or something.
Yeah. He was talking about how he got it off of Temu.
That was the joke.
The joke was
Yeah.
that he got it off Temu, but it actually, he goes through the steps where
3D printed steak.
Yeah, it's real, man. And he ate it and he cooked it. He ate it and he said, he's like, to be honest with you, this isn't that bad.
Like,
yeah.
See this? Yeah, I think this is it. Look at that.
Is that a pea protein and algae?
Sheena is huge. She, like, if you show her this, she will now think that this is what's in grocery stores.
It is in grocery stores. I'm already convinced that that's what they're already giving us. Like, we were watching RFK this morning about
the dye,
we're
the yellow
being
dye.
poisoned with our foods right in the grocery stores as it is. So
Yeah.
why wouldn't this is cheaper. Plus they're trying to sell meatless meat. This is the meatless meat.
Well, it's 3D printed. I just
They
don't
don't have to
understand.
say that
I don't
though.
understand where the material comes from. I
That
don't
is
understand.
scary.
Isn't it scary?
Scary, man.
But like the macros are there, which is weird. Like the calories are there, the protein's there.
As far as like the chemical and genetic makeup over time, like that's what makes me nervous about when you ingest something, your body and bile breaks it up and turns it into something completely different. So how's that altering your genetic makeup?
Yeah. I
Like
mean,
would that make me in what is it when you can't have kids? Incontinent?
So dive into that. So when you digest something, you have the macros of the food, the raw food that you're eating. When you digest it, you're not getting all of those macros, correct?
No.
there's no way
your
you're
body
getting
breaks it down
plastic.
completely different.
But also the way the protein synthesizes and your body absorbs this material. Essentially, what is this material? So, like, if you're eating well and your body's absorbing it, you notice. Like, I notice that my hair looks darker and my beard doesn't flake as much when I'm having like cold pressed carrot juice in the morning and like a
Mm.
bunch of keratin in my diet. And I'm juicing and I'm hydrating. I notice my hair feels different. It feels
Yeah,
thicker.
I gotta try that.
My
then.
beard doesn't flake as much. Even my skin, I have seborrheic dermatitis
Yeah.
over
Wow.
here. When I eat better and I don't eat like crap, my skin's better.
Yeah.
But
God,
I notice
it's so
after like a
true.
night of drinking out with my friends and I'm eating like crap, my skin will be red over here and I'm flaking.
Puffy
Mhm.
eyes.
Yeah.
Same thing.
We
So
just
getting
went
back-
to a birthday party last weekend and we decided to just go ham on all the delicious food they had
As you
there.
should.
Instant breakout for me. It does. It's your internal. I mean, it took a week, but what you eat is what you become. So that is
Yeah.
true.
Yeah, it takes a while too to see those results because it doesn't happen right away. Like we were in Florida a couple weeks ago and I followed this diet that we're on. It's a really lean diet. We do like rice cakes, oatmeal in the morning, egg whites, 5 ounces of beef, 4 ounces of greens, 8 ounces of sweet potato, the whole nine. We got it all played out. We weigh all of our food. And I did that for about 2.5 weeks straight. Didn't cheat, didn't do anything. Both of us did.
Yeah.
And the results I saw were incredible.
I would have felt like a superhuman.
My
on that.
abs came in, everything. I felt great. I had energy, and we broke it. What ended up happening? I don't even know what
We
Yeah,
just
why'd
happened.
went
you
to
break
we
that?
went,
That sounds
we went to
We just
Florida
went-
for 3 days. It was only 3 days.
Yeah,
And we ate
the
ate
hotel
out.
food was so good.
It was,
Where was
so
this?
good.
We went to
Tampa.
Tampa, and we stayed at the Hilton.
Nice.
And I'm telling you right now, they don't even have food like this around here.
Yeah, it was
It was
delicious.
so good. So like, I was ordering everything on the menu.
As you should.
You know what I mean? Like I went
Great.
from having, I went from having oatmeal in the morning with egg whites to being like, okay, let me get that avocado toast. I'll take 2 bagels. I'll take a bacon, egg, and cheese. I'll take this. And I ate it all. And that was just our 3-day thing. I didn't see it right away. I didn't feel that bad right away. But like 4 or 5 days after when we got home, I'm looking in the mirror and I'm like, oh shit, it's starting to hit me now. Like I can see it now. I'm
Sluggish,
starting to feel like
everything.
crap.
Yeah.
Just to like sum it all up, I think like, people expect to feel better right away when they do something, but it takes time.
1000%.
It takes time, even if it's bad, even if it's good, it takes time to eventually get the benefits or the negatives from whatever it is that you're doing.
Yeah.
What are some of the most common mistakes that you see people make when they are trying to, in recovery from an injury?
Consistency. Consistency is probably one of the biggest mistakes I see. They think we just touched on it. It's you try something and then you don't stick with it, and then it just falters. And what it does is it ruins with your mental. So anytime I'm anytime I'm telling a patient to do something, I try to give them as less as possible to do and see if they're even going to do it
Good.
to begin with.
Yeah, good
So
idea.
they're like, "Oh, I want to get into working out, let's say," right? I'm like, "Great. I want 2 to 3 times a week." They're like, "Oh, I was thinking 5." I was like, "I think not.
Yeah, start little.
You're not going to be able to do 5. You're telling me you want to start working out, and that's just it's not going to be possible because you're going to miss 2 days of working out, and your mental state's going to be like, "Man, I missed those 2 days. I got to make up for them." That's not a plan to stick with. So we stick with 2 to 3 days of exercise, 30 to 45 minutes. If you can do that consistently for a month, then I'll give you another day to do if that's what you want. But if you can't even commit to this small plan that I'm giving you, then no, that we're not doing 4 to 5 days a week.
Mm.
The same thing goes with rehab. If I'm telling them to incorporate an exercise, let's say before their run, or a shoulder movement if they're dealing with a shoulder injury, they're like, "Oh, should I do it every day?" And I'm like, "No, do it 2 to 3 times a week
Yeah.
before your workouts."
Yeah. Yeah. The rehab that I had for my shoulder was brutal. And he had a similar approach where I think it was 3 days a week, but he made it very clear to me that if I missed any of those days, that this was not going to be a full recovery. So I took it really serious, and believe it or not, the surgery was great. It healed good. The recovery was good. And that was about 4 years ago. And I just retore it recently, just
Oh man,
probably 3 weeks ago,
do you
two
know
weeks
what
ago.
muscle it was?
It's the rotator cuff. It was
There's
the
4 rotator cuff
Yep.
muscles.
It was
You want me to
the
start throwing them out?
yes. The labrum.
So, it is so the labrum's not a rotator cuff.
Okay.
Rotator cuff muscles are you have your supraspinatus, infraspinatus, teres minor, and your subscap.
Okay.
So if it wasn't any of
Subscap.
those, it was subscap.
Subscap.
How'd you tear your
But
subscap?
it
That's a
was the
hard one to
labrum
tear.
as well. There was two of them. I know one of them was the labrum, or it could have been maybe just the labrum. Does that make more sense?
Yeah, so the labrum is the actual. It's sort of the ligamentous structure inside where that ball and socket joint fits in.
That's what it is.
So
That's what it is.
and what happens is if that causes shoulder instability, then your muscle's pretty much attached to that ball that attaches into the socket.
Exactly.
So the rotator cuff muscles that attach there, if there's instability, then they're fighting to keep that in. So those muscles are going to get messed up as well because of that labrum being torn.
How can I strengthen that without having to go get this surgery done again?
Oh man, what movements hurt?
So just that hurt.
Just bringing that up.
Just here.
And now you work overhead a lot.
No,
Okay,
thankfully,
that's good.
no. Just certain movements. Sleeping at night hurts a lot.
Do you sleep on your side or on your back?
Even on my back.
Yeah.
Yeah.
And it just sits there and it hurts.
Yep. Just throbbing pain. It's something I have it on my right side too. I feel like I've been dealing with it for years, but after that surgery, the recovery, like I said, was great. I didn't do anything for about a year. I mean, I really took it serious. First 9 months, I did the rehab every day. I went when I needed to go. I followed it all the way through, and I didn't start working out for about a year. But like I said, even up till 3 weeks ago, it was fine. No pain, no nothing. And then I was on flat bench, which I don't recommend anybody to do. I hate flat bench. I think it's the most ego driven lift that you can do because
Yeah.
it doesn't even really give you many benefits. It's just a stupid thing. I don't know.
Yeah.
So that's how I ended up hurting. I was doing 3 plates, ego lifting, and that was it.
Did you at least hit the reps?
Yeah, I got it.
All right, we got it.
And
We got it on film.
I even said to her, I said, something's going on with my shoulder. And I was like, whatever.
I'm going to be honest. It was
figure it
probably,
out.
did you feel anything while you were doing the reps?
Yeah.
Oh, it happened you felt it happen during the lift?
It didn't. No, it happened. It happened afterwards. But when I did it again, I felt it during the lift. So the first time when it happened, it was initially when I put the bar back on, and then I did it again.
Here's my thing is the labrum could have already been partially torn even prior to doing that. And you could have just aggravated some muscles in there. And now those muscles are fighting for their life, trying to restabilize the area.
So that's a good point, because the last time I did that, this happened, I gave it time and it did end up fixing.
Yeah.
It ended up feeling better after a while.
There's a basic set of 12 exercises that I recommend for like after initial injury. Because like I said, you don't want to throw too much at it. They're called the Buckburger 12, and it's 12 different exercises that you'll do for like three sets each, 8 to 12 reps. And it's 12 consecutive exercises that you're going to do for your shoulder. I'd recommend doing those for about like 3 to 4 weeks and seeing how the shoulder feels.
Yeah, shoot them over to me. I'll definitely do that.
Yeah.
I need to do something to strengthen it. She's having shoulder problems too, and shoulder
Started
problems are just the
lifting
worst,
heavy
man.
this year.
I wrote
Yeah, they're just the worst.
my scholarship poster that I won at Manhattan College was on pre and post op surgeries and exercises to do for them.
Wow.
And it was on what's called perturbation training, which is perturbations. It means instability. So have you ever seen dudes like balancing on Bosu balls?
Yes.
A similar concept, only when I was powerlifting, one way to get my numbers up was I would hang kettlebells on exercise bands. So when I was benching, I mean, you could use 30-pound kettlebells on each side, and it's going to burn you out.
Yeah.
Because what it's doing is the research that I cited in the article said that anytime you were doing an overhead press, if you were doing it with a straight bar, you were activating, your front delts, your traps, posterior upper back muscles. But when you use the instability training, you were activating all of your rotator cuff muscles by up to 20 to 50% more than if you were doing it with a straight bar. You were even activating your core, because what's going to happen is the plane of direction is no longer linear. Now, because those plates are dangling, it's throwing you off center, and all the muscles getting the weight up are trying to drive it in that linear upward, up and down motion. But in order to do that, those muscles had to react to the weight shaking.
That makes sense.
I've seen that. Okay.
Yeah, that makes sense.
Ash, can you pull up the Combat Chiro on Instagram? I want to talk about your content a little bit because I think you do an incredible job.
Thank you.
I want to know who does it, first of all. Do you do it?
I make the posts and I make the captions. I have a video editor that's been with me ever since I started Strive when I had 500.
What's his name?
His name's directed by Angelo Aldana.
Angelo. We're working with him.
Oh, he's man, he is
October
phenomenal.
1st and 2nd. We have a full day. He told me, he said, pick a day because we're going to do like a day in the life. Because a lot of my days are just very full of a lot of different stuff. We have multiple businesses. We have the podcast. We have our fitness stuff. We have our family.
Yeah.
So like, I want to try to capture all of that.
You guys are like superheroes.
It's
amazing. Just when I think I'm working hard, I meet other people that are absolutely crushing. I'm like,
it's awesome.
I gotta work harder.
We
It's
just
awesome.
have great synergy. I think together we're a superpower.
Yeah,
but I mean, it definitely.
Sure.
We work on that synergy. Once you find your other half, you can get that much more done.
No, I just recently got out of a relationship a few weeks ago.
Okay,
yeah.
a few weeks.
Sorry,
it's all right.
So
this one was actually this past weekend. I was teaching a dry needling course in Fort Lauderdale.
Oh my God.
To other chiropractors and physical therapists.
Do you get nervous at all doing this?
Never.
Really?
The only way I'll get nervous is if and I won't even adjust them. So you'll know if someone's having like a severe adverse reaction, like numbness, tingling going down the arm, etc. So you typically don't want to light it up. So there's other techniques that I'll do. I'll do mostly soft tissue work.
What is this? He started saying, "Oh no, I'd rather you not do that one."
Oh, so I was gonna decompress his neck. So I was gonna come underneath his chin and back of his head. I was gonna pull his head off.
Nothing major. I was just gonna take his head off of the neck area.
He said he liked my speed because he's another chiropractor as well. He's over in Denver.
Oh, okay. Did you see the chiropractor place downstairs when you walked in?
I did.
Yeah.
Forgot the name. I saw it. I was like,
actually,
check it out.
we didn't notice it until Tuesday when we were walking out, and we've been walking past that this whole time. But we just happened to notice, oh, there is a chiropractic.
Nice.
Place
So
right here.
Angelo shot this, or this looks like just a phone.
This is Mac's camera.
Yeah,
we just had another chiropractor just filming it, but he just did this quick on CapCut.
I want to get into the business side of things because you own this company, correct?
Correct. So this is one of my patients. She's a JWU soccer player. And she's been dealing with a lot of calf pain because,
So there's your acupuncture.
Oh, good.
Yep, there's the cupping, that shockwave therapy. That's done amazing for some of my patients, especially for...
What's that, shockwave therapy?
So it's essentially what it does. It emits deep vibratory sound impulses and it helps stimulate the muscle fibers. But not only that, what it helps do is increase inflammation to soft tissue. Now, the reason that's important is because anytime you're dealing with a tendon or a ligament, let's say I cut you open. You're going to notice that your muscles are nice and red and plump with like vasculature. Whereas you have a chicken breast in front of you, you see a white strand.
Yep.
That's a tendon.
Yep.
So tendons and ligaments don't have the same vasculature as muscles, which is why they repair a lot slower, right? You strain a muscle, you're back in the game in, a few days or a few weeks, depending on the severity. You hurt a ligament or a tendon, right? We see like in NFL athletes, they're out for weeks at a time and potentially the whole season. ACL, they're done for the season.
Yeah.
they heal a lot slower, and it's because they don't have a blood supply to them. So one great thing that this machine does is it helps increase blood flow to tissues, which
To
helps
speed up
speed
the
up.
recovery.
Exactly.
Is that the same with cupping? Can you go? I love ancient modalities. I think they're amazing, but I haven't dived into cupping at all.
Cupping I like because of the vacuum effect.
Okay.
So let's say I come in with someone and they're having severe lower back spasms. I want to dry needle them that appointment. But the thing is that needle, they're going to be in such spasm that the second I even touch their skin with a needle, it's going to go into more spasm, which isn't going to allow me to target the area that I want.
Is it because it's a pressure point?
It's called nociception, which is like their pain response. Their pain response is already high. So what you want to do is you want to desensitize the area, right? That pain regulatory system, you want to inhibit that.
Okay.
So one way I do that's with the cupping. I create a vacuum effect around the skin. It helps descent. It's kind of like
Is that why they do that?
no, cupping essentially helps increase blood flow to the area that's being vacuumed.
For faster recovery.
Exactly.
Okay.
So if you're having soreness, if you're dealing with a strain, what it'll do is it'll localize blood flow to that tissue, inflammation, in hopes that it gets better over time.
Sheena knows a lot about the human anatomy. She spent some time in surgery as an
yes.
operations assistant.
So I was a surgical assistant, and
Cool.
I did that in the Air Force. And like you were saying, I got the chance to cut open bodies and see the muscles from the
Isn't
inside.
the human body amazing?
It is
I
phenomenal.
tell people it's literally the most intricate and beautifully
crazy.
crafted piece of, I don't even want to call it machinery. It's the most beautifully crafted piece of art that'll ever happen. I mean, they could go in depth as they want into AI. The things the human body can do are absolutely immaculate.
It's absolutely, you said that really well. And it's hard to put into words because when you go inside the body and you're able to repair it, like when we're talking about rotator cuff repairs, like I've been there where we've put huge needles into the cartilage and into the muscle just to put them back together, but it's just not as beautiful as the actual human body. We just can't compare. So whoever created us, there's obviously a higher power that designed these bodies. Labor and delivery and the whole process of growing humans inside a human body has just blown my mind.
Isn't that amazing?
Since day one. Yeah, it's really
Are you guys
incredible.
religious?
I believe that I'm very spiritual. I grew up in a religious home, so I'm spiritual but not religious.
Okay.
There's
I love this
definitely a
topic.
different.
I believe in God. I'm not sure what that consists of yet.
My grandfather was a priest.
Oh,
Was he?
really?
Yeah.
Yeah.
He was a Greek Orthodox priest. So Greek
Greek.
Orthodox priests can marry.
Yeah.
Okay.
Yeah.
So I think I mean there's got to be there is a greater power. There is no doubt something that created us, put us here for a reason. You know, we're just here trying to figure out what that reason is, and all you can do, in my opinion, I love Christianity because of some of the things they believe in is treating others around you like your brothers, and just I'm all about unity, bringing people together, and just treating people with respect. And I think religion instills that in a lot of people. It instills to do the right thing. You know, that gut feeling of doing something wrong. If it feels wrong, then don't do it.
Right.
You know, certain things like that come along with religion. And then there's a lot of things that like I think are crazy about religion. Like I saw this guy the other day. He's a priest and he travels the country and there's something about him that just makes my skin crawl. There's some ups and there's some downs that I see in religion, but for the most part, I am a faithful man. I believe in God. There's definitely a higher power that has put us here for a reason.
Yeah.
Are you
I
religious?
like how you mentioned faith. I just started going to church more diligently this year. I started back in January. I've just been going to church every Sunday.
Yeah.
Now, in terms of like the biblical stories, like those are a little bit more far-fetched to me, but I think what I like about going to church is I just kind of get to I go by myself.
Yeah.
I was going with a friend at first because I was nervous to get back and
That's what we're gonna do. We're gonna go with my friend Todd.
Yeah.
And
it's good.
Yeah.
And then I just started going on my own, and I kind of take that as my time just to. I like to tell people I'm not super religious, but I'm a man of faith.
Yes,
Yeah.
And
exactly.
it gives me. I went through 2 tough times this year now, where if I was in my own head, I would just get bedside and just pray, and even that outlet, just being able to talk to someone, and I'm talking to no one. I'm trying to talk to God or Jesus, and but really, I'm just having a conversation with someone, and hopes that they're listening and to give me strength and to give me power and to help me, help me through whatever I'm going with. And just that talk, I guess, is me almost having like seeking a counselor, but like I don't have someone at the other end necessarily judging me because God and Jesus are non-judgmental. They
Yeah,
accept you for
yeah.
who you are.
Do you think that praying and manifestation are a lot alike?
Completely.
Yeah.
So like, yeah,
What do you think of mindset, manifestation? Do you have a ritual that you do every day? We started getting into waking up early, kind of we sit Indian style in front of each other on the floor and we kind of think about the day ahead. We think about the things that we want to accomplish for that year. We set our goals for the day and then we talk about them. Do you
I
do
like that.
anything like that?
I actually, there's like a thing that I say to myself when I'm like washing my face or brushing my, after I brush my teeth. And it's very simple. You guys might have heard it, but if not me, then who? So, going into work and I'm like, all right, I want to do this. I want to do this. I want to do this. And there's, and like I told you guys, like you guys are a great example of something I aspire to be when, in terms of consistency and growth. If I'm not going to be the one doing it, then who's going to do it? Someone
Yeah.
else.
Yeah.
That should be me then.
Yeah, nobody else is going to do it, man. That brings me to a really good point of what I wanted to talk about is your business and how you started your business.
Yeah.
Obviously you're a really, really smart guy. And, first of all, thank you for coming on.
Thank you. Sometimes I don't feel so smart.
No, man. I mean, it's, you have to be.
When I leave the office, I'm like, am I smart?
what you're doing and you turn a business into it, that you should be very proud of that.
Thank you.
How long have you been in
Absolutely.
business?
Coming up on 2 years in January.
So you made it through your first year.
Made it through my first year.
How was
yeah.
that first year?
It was a hard year, but it was so, I want to say it. I finally learned to be like proud of myself.
Yeah.
'Cause
Gratifying.
It was
I have a
very,
hard
it was
time
very
with that.
I
Yeah.
have such a hard time. People are like, you should take it easy on yourself. And I'm one of those ones where I never had like too much positive reinforcement growing up. So it's like, am I really doing enough?
I think that's some of our superpowers though.
Yeah.
Really. I think
Yeah.
I think that's, guys like us, I think we have an edge over people who got too much positive reinforcement.
Yeah.
Cause I think too much could be damaging, to
so
the
too.
point where you think you're doing enough, but you're really not.
Yeah.
So if you're always kind of playing the back nine and like thinking that you're not doing enough for yourself, you're always going to be striving for more. I have a very big problem
Striving
with
for
that.
more.
Yeah. Let's talk about so you got into 2 years ago you started your business.
Correct.
Where did you come up with the name? How did the name originate? You just went into it a little bit, but I want
Yeah.
the audience to hear it.
So I was just leaving my last job. I was working in private practice at an office in East Providence. They were amazing. I had a female boss. She was tough. I mean, tough on me.
They must have been really upset that you left.
They were, man, but
They're
the
supportive.
great thing is they were so supportive,
Good,
and I
good.
still talk to them to this day.
Good.
Like when I hopped on a call with her, we FaceTimed like probably about 4 months ago now, and I'm showing her around my office and I'm showing her my car that I bought myself for my 30th birthday, and she's like tears going down her eyes.
That
like, I'm
says a
so
lot
proud of
about you, man. That's awesome.
Yeah, and I never wanted any bad blood. I gave them 4 months notice, so that was in 2022.
Good
Yeah,
for you.
I was
Good
like,
for
you guys find it when you guys find someone, I'll help train them,
Yeah.
and then I'll be ready to leave. Because I was in no rush. I wanted to make sure that I did right by them and did right by myself as
Yeah.
well. But I was leaving for a vacation. I needed a break between having the lease signed and getting the name of the business and the website and the office ready and leaving the job. I just needed a break. So I was like, I'm going to go to Lebanon and visit my family.
Nice.
So the night before my flight, I go to CVS and I just grab a bunch of snacks. I grab, protein bars and some chips and some nuts and beef jerky because you need some protein on the flight.
Yep.
And I wasn't even looking when I grabbed it. I was like, beef jerky, grab it.
We pile through beef jerky on the plane.
Yeah, so good. My website guys are contacting me as I'm at the airport in Boston. Like, hey, like we really need a name because we want to start working on the design with the graphic designer who's going to be designing your logo.
Yeah.
And we don't want to wait until you're back because you're going to be gone for a month. I said, no problem. I'm still going to have service over there. Let me figure this out. I'd already thrown out some ideas. Originally, it was going to be Flex with 2 X's. So it was going to be Flex, Spine, and Sport.
That's
And
nice.
they're like, nah. And I'm like, Advanced Chiropractic Clinics. And they're like,
Who are you confiding in about this?
my website guys.
Okay.
Because a lot of what they do, they're like 2 studs out of like new graduates out of RISD that I put all my trust in.
Yeah.
They actually designed the website for Marcelino's, the boutique bar downtown.
Okay.
Was it Joe?
No,
Oh.
it was Seth, Sebastian, and Billy. Natal. They own. I forget what it's called. But anyways, I
On
went
the
through them.
spot. It'll
Yeah,
come
yeah.
to you.
Yeah, it'll come to me. And then my graphic designer, Jackie Gutierrez, she owns Jack Designs. Nailed my logo with my personality and everything I wanted in terms of embodying what I wanted the practice to be. So I'm on the flight and I'm hungry. So I take out my bag, I grab the beef jerky, and I'm like, oh, Strive. Oh, spelled with a Y. That's pretty cool. Powering through it. And I'm like, Strive. And I'm at the same time, I have my notes up and I'm looking through the names that I wrote in my notes. And sure enough, I just look at it and I'm like, Strive, Spine, and Sport. And I'm like, okay, that's actually pretty catchy. So as soon as I land in London, my connecting flight to get to Lebanon, I text them. I'm like, what do you guys think about Strive, Spine, and Sport with a Y? And they were like, bingo. That, like, all the text messages are
The
coming in. Like,
three
that's it.
S's.
We're going with
The
it.
three S's is huge too.
Yeah.
Strive,
Yeah, and that's
spine,
what they
and
really liked
sport.
about it.
Yeah.
And then when they told Jackie, my graphic designer, she was like, love it. I'll start working on samples right now. So she came out with like a regular logo and then the actual practice logo.
So when you first
Awesome.
started your business, did you have a nest egg that you had saved up in to put into all of this? I mean,
Yeah.
talk about the equipment that was needed, the tools, like what how long did it take you to get all this stuff together?
When I first opened, I actually didn't have it fully, my office fully designed. I went through two people that I got to give credit to, Kelsey and Pauline. They helped with the interior design in terms of picking out my furniture, the accent wall,
Oh wow, that's
Get-
nice, dude.
getting that. And there's even cooler. I actually should update these pictures because there's cooler stuff in the where that small table is,
Yeah.
that small little wall now. There's shelving that has like Dr. Mike and like a
Oh,
cool like little
good.
spine with where for the I in my name.
Yeah.
I saved up first and last month's rent for this, and then the original deposit, all the furniture, hiring the website guys, hiring the interior designers, hiring Jackie for the logo, business cards, getting my chiropractic table, my desk equipment. It was probably about 25 to 30 grand.
Wow, I was gonna say
Wow,
30 to
yep.
40. That's good.
Yeah, but I think about 30 grand.
Is anything insurance related with this kind of stuff?
I don't accept insurance. I'm more out of network. So the last practice I worked at was insurance based. Now, what they do is good standard chiropractic care. I didn't want to go the insurance route because one, it would mean that I would have to lessen my appointment times with people. And I really wanted it to be a boutique practice where people actually want to pay for a certain standard of care that I offer.
Lessen your times because you would have more demand?
Yes. And then I would just have to jam pack my schedule and be seeing
Yeah.
40 to 60 people like I was seeing at my last job.
And that's because if it's insurance based, they are the ones that are throwing the work at you.
Yeah, right.
And you have to fulfill whatever obligation you have with them.
Exactly.
Yeah.
The chiropractic visit's covering adjustments. It
Yeah.
doesn't cover much more than that, where I wanted to incorporate all these other modalities that aren't necessarily covered by insurance.
That's awesome.
However, if someone has out of network care, what I do is I can write them a bill and then they can submit that to their insurance and get reimbursed for it.
Mhm.
So it depends on the kind of coverage that you have. In terms of people coming to me, I've had CEOs of different businesses around the area come to me. I've had people in poverty and they're paying for my care. And then they reach out to me. They're like, thank you so much. Like, it was expensive, but whatever you did, like, my dad doesn't have pain anymore.
Wow.
You know what I mean?
Can you share one of your biggest success stories?
Yeah. One guy he was a week out from getting spinal. He came to me on a whim. One of his workers, one of his employees that works for him was like, go to this guy. And he's like, all right. I mean, I have an orthopedic consultation next week where I'm literally about to set up my date to get my spinal fusion. Comes into my office, man, dapper, large guy, military. And he comes in and, he's just like, hey, like, this is what I'm dealing with. And I'm like, all right, cool. Let's try this. So I dry needle his lower back to where I'm pushing. And I'm like, realistically, your cartilage is worn away. Your muscles are struggling to sort of have some sort of stability down there. Let's throw some needles in your back at these levels that you're saying are bulging. Um, let's do some soft tissue work. I did a lot of scraping and I adjusted him. He was literally, he tells me, he was like, I had the orthopedic consultation set up to set up my spinal fusion. I was going to be fused on 3 different levels and he no longer needed it. Yeah.
That's incredible.
Like they were about to cut him open. He was setting up the date to cut himself open. The
What
following
would
week.
have happened if he did go that route?
He would have gotten the spinal fusion.
And he probably would have been dealing with that for the rest of his life.
Potentially, I don't know. It depends on the cert. Like I don't want to say for certainty.
I mean, how successful are spinal fusions? That like
they're hit or miss.
Yeah.
Like they could be good in the short term, but after there's a few articles that come out where after 10 years it sort of reverts back because there's minimal movement there, which means that there's barely any lubricant between the two vertebral bodies and the disc space between them.
because of the movement.
So it's going to wither away,
Right.
and then you have other problems that happen, from it. And realistically, when you're putting other stuff in your body, your immune system also has to battle with, oh, there's like titanium in here now.
Yes.
And you have muscles
Yeah,
growing and
that's-
attaching to that, whatever you want to call it, excess material in your body.
Yeah, the foreign objects, your
Right.
body is trying to either accept it or reject it.
Right. So you have to deal
Amazing.
with that in the beginning.
Yeah.
And like I said, I've seen surgeries go well. Probably the worst ones that I've seen are cervical fusions. Those are hit or miss.
Really?
Yeah.
Have you treated botched surgeries? I don't want to
I
say
have.
botched, but surgeries that didn't go well.
Yep. I had one patient that came in. He had a cervical fusion in his neck from levels C3. C3, when I say that, it's cervical vertebrae number 3. There's
Yep.
7 of them.
Right, right.
It was C3 to C7.
And then it goes from top to bottom.
Yep.
Yep.
So it would be C3, C4, C5, C6, C7.
Yep.
So from C3 to C7, he was fused. His top 2, C1 and C2, weren't. His daughter reached out to me and was like, hey, listen, like my dad might be going back to surgery. Like do whatever you can on him. I know he might need the surgery again. He feels like a screw's loose. So he comes in and I'm like, look, I can't adjust your neck. You're having pain in areas that I'm touching along the spine. I'm going to throw 3 needles on each side and this is hit or miss. The verbiage I used with him was, I don't know if this is going to help you, but I know it's not going to hurt you.
Yeah.
Because at the end of the day, you do have that consultation.
Yeah.
He was also going to go in under, again, and redo his surgery, and he didn't need it anymore. Ended up just being his musculature around the area was spasming, and it was made it feel like a screw was loose, but it wasn't.
What is some of the key differences in treating spinal injuries versus extremity injuries?
If I'm treating extremities, I try to see if it's being related to the spine. So you have some people that are having an extremity injury where, they have throbbing in the forearm, or it's going from their shoulder down to their fingers. And the first thing I do, I'm always going to start from the root cause. So I'm going to see, okay, is this something that's happening from the spinal cord and it's a nerve coming out of their neck that's causing a pain referral pattern to go down the arm? So that's the first thing I'll assess.
So you just figure that out by process of elimination?
Exactly. You do multiple testing. So like, I'm like, okay, tilt your head this way and close it. And what that does is it impinges the spinal nerve root that's coming out of the neck. If they go like this and they're like, whoa, that's shooting down my arm. Okay. Now we're dealing with something that could potentially be happening from the cervical spine itself and not exactly have it be an extremity issue, but more of a cervical issue that's causing the extremity issue.
Got it.
Does that make sense?
Yeah, absolutely. You were a power lifter at one point.
I was in everything. I did CrossFit, powerlifting.
So what was the differences? So did you start off powerlifting?
I want to say my mentor when I first started lifting, yeah, he was powerlifting.
What made you transition to, because I've noticed that you kind of have like a hybrid type style.
Love it.
Yeah. So what made you transition from the powerlifting to more of a hybrid boxing overall? Just what made you change that?
I think it was how I felt.
Yeah.
I felt strong and large as a power lifter. I just felt I felt bulbous, which is a good feeling.
Yeah.
And you feel strong and weight comes easy. But I didn't feel athletic necessarily. Being my background was in wrestling, I like having a sense of preparedness in any situation, where I feel dangerous, where I feel unique and athletic and powerful. And I didn't feel that with powerlifting.
Yeah, you don't.
I feel dangerous and I feel elite when I have a sense of like aerobic and anaerobic conditioning.
Yeah, where you can move.
Where I can
Yeah.
move, and I'm
Yeah.
also doing my boxing and jujitsu. I just feel unstoppable.
Mhm.
It makes me feel good. My body feels good. When I was powerlifting, I was like, man, joint pain and
Dude,
my wrists hurt and my
yeah,
knees.
yeah.
The
reason I ask is because so I've been lifting heavy now for about 6 months, and like we've been really going hard every day. It's hard for us to not go to the gym. Put it that way. It's like we struggle with days off. So
That's great.
Yeah, I mean, I guess, but we're always dealing with these these aches and pains and from lifting so heavy. And
So have like active recovery days. So if you're going heavy like 4 days, and you want to go to the gym, those 3 days can be active recovery where you're keeping your
more
heart rate at
cardio.
zone 2 and you're doing like a kettlebell circuit
Yeah.
where you're not absolutely butchering yourself,
Yeah.
but you're still getting the sweat and the conditioning that you need.
Yeah.
And it's translating to those 4 days where you're doing those heavy lifts.
Yeah. You know when I felt my best is when I was boxing. When I was doing mostly cardio.
Yeah.
You know what I mean? When you take and even when I was boxing, I was still doing weights. I was curling, doing a little bit of bench, nothing crazy. My overall goal wasn't to get sculpted or big. It was to get agile, athletic. I could move quick. I could slip. I could slide. I had fast reaction. But you're 100% right. You feel way better overall when you're doing that kind of stuff.
Well, yeah.
And you don't have to deal with the injuries because the injuries are just a burden to deal with. And, I have this thing right here. Maybe you have seen it. It's this pain that like every time I move my elbow, it's a shooting pain that goes down to my hand. And
Any particular fingers?
the left two, these two.
Okay.
So it's right here. It almost feels like it's on the bone, but it's very sensitive to the skin. So when I touch it here, it's very sensitive to the skin, but it's also here too, inside.
Yeah, so that's where all your flexor muscles attach right there. That's it sounds like a dinosaur. It's called your medial epicondyle. And essentially all the muscles that flex your wrist and move your fingers attach to that one area right there.
Huh.
So if you're and the thing is you have nerves that run under here. You have your ulnar nerve and you have your median nerve. So if those muscles are very bound up, what it's going to do is it's going to create less space for that nerve to sort of slip and slide in between those tissues. Not only that, it just under load, the tendon itself could be stressed out where it attaches over here onto the bone. Assessment from what you're telling me, I'd probably just stick some needles in it, or I'd probably do shockwave to your wrist and see how it feels after.
How do you feel about peptides and stuff like BPC 157, TB 500?
Yeah, I did BPC 157 and TB 500, not the injectables. I did the nasal spray. I can't say I felt any different, but
How long did you do it
I didn't
for?
feel worse. It was a 2-month supply.
Oh, okay.
And I didn't finish it. I was dealing with an ankle injury and a lower back injury. I guess it helped a little bit. Had I injected, I think it would have been a little bit better, just because I think with those peptides, you really want to insert them locally around the actual area.
Oh, really? I didn't know that.
Because what BPC 157 and TB 500 are supposed to do is it's supposed to increase the process of angiogenesis, which is creating more blood vessels to the area. So angiogenesis is the creation of blood vessels. And because TB 500 and BPC 157 work really good with tendons and ligaments, by creating those channels of blood flow into the tendon and ligament, we said before that those are two tissues that are avascular, that lack blood flow for the most part.
So slow recoveries if it's lacking blood flow.
So what BPC 157 and TB 500 does increases those blood channels to those tendons and tissues, enhancing recovery.
Can you achieve that also with cupping then?
Yes, but at a very slower rate. I mean, you don't want to be cupping yourself every single day. I wouldn't like if you're dealing with a minor tendon issue, I would mostly like cup the muscles. You could cup the tendon, but you're going to get a very slow recovery at it.
Again, because of the blood flow or lack thereof.
Like one thing I do, let's say if I am dealing with someone that has an Achilles injury, I like doing blood flow restriction. So what I'll do is I'll blood flow restrict right around the calf about halfway, and then I'll scrape out the Achilles tendon a lot, like really inflame it. It sounds as bad as it feels as bad as it sounds.
Like literally scrape the tendon?
Scrape the tendon completely.
How do you get in there to do that?
Just right on top of the skin.
Okay.
And then what I'll do is I'll like flick the ankle back and forth as I'm scraping it through motion, and then release the blood flow and just let it completely go back. And then I'll scrape it again, and then I'll restrict blood flow again. Essentially what I'm doing is I'm causing inflammation to the tendon, but blood's not able to get there. So the body's like, I need to get to that tissue. It is inflamed and it's painful and it's hurting. So as soon as I take off the blood pressure cuff, it surges over there and you just see it's like all red and lit up.
That's cool.
It looks like it's about to bleed.
Yeah.
It's cool.
Blood is another incredible topic. We just donated blood 2 weeks ago.
Nice.
And felt better that entire week. It's almost like you're
because I was
like an oil change.
My red blood cell count was high. So
that's great.
It's funny enough to to say when I was there, I was in the bus, and I got a call from my doctor saying, yeah, your blood work came back and your red blood cells high. And I'm literally, I have the needle in my arm, and I'm like, well, it just so happens I'm getting blood taken right now, so that's going to fix that problem.
Nice.
Which I did feel a lot better. If you could debunk one chiropractic myth that drives you nuts, what would it be?
That's too many.
I just know I'm going to get so much hate for this.
If you have a couple, you could say a couple, but what's the biggest thing that drives you absolutely crazy?
I am not realigning shit. Like, I'm not putting anything back into place.
Got it.
Right.
Yeah.
You know what I mean?
Yeah.
What I'm doing is I am creating a central nervous system response by popping and cavitating that joint, releasing pressure from it to help improve range of motion and stimulate your central nervous system. That's all I'm doing.
That is so
Nothing
well
is going
said.
back into place.
So that brings me to
I'm creating a central nervous system response to where your body recognizes that and helps you feel less pain.
You're not putting them back together. So that brings me to my next
That's
question.
amazing.
What's one of the most wildest, surprising things that someone's came to you for thinking that it was going to fix them? Say I came to you for something kind of ridiculous, and I'm like, I think this
Erectile dysfunction.
Really?
Yeah, and it
what
worked.
the heck did they
It
want you to
worked.
do?
And it worked.
What did they want you to do?
So they were like, look, I'm going to be honest. Like, I've been having a little bit of back pain and like there's something else. And I'm like, what's up? He's like, I'm like, erectile dysfunction.
Yeah.
He's like, yeah, man, it's been happening a lot more frequently. So I was like, okay, I'm going to stick some needles in your back. Because at the end of the day, those spinal nerves, those L5, S1, they provide sensation and
the network to to everything.
Exactly. So if he wasn't getting the proper motor and sensory response to his pelvic floor muscles, then he wouldn't get a good erection. It's actually been a few guys now, but I needled L5 and S1, and I needled L4, L5. That's lumbar vertebrae number 4, lumbar vertebrae number 5, and even needled his SI area, like just to stimulate the S1, S2. And
how did he tell you that it eventually started working? Did he call you?
It's funny, dude. Like, I'm on such a great rapport with my patients. I came in and I looked at him and I was like,
yeah.
He goes, doc. I was like, seriously?
Wow,
he's
that's
like,
awesome.
He's like, I'm telling you, man. I'm like, that's great.
That's awesome.
Yeah, that's
I just took my forearm and just slapped. I was like, hey.
What does Jared call it?
His hammer.
His hammer.
I was like, hey, what do you do? Are we good? He's
That's
like,
funny.
He's like, I can't believe it.
Yeah,
wow.
That's incredible.
I'll
life.
pass that information along. I'll if that ever comes up, I'll
Which
let
the
him know.
shockwave machine, actually, I didn't use shockwave, but it's not in my scope of practice to treat erectile dysfunction. He said he was having issues.
But that's what's so cool about what you do. And like you said before, it's like you're doing stuff outside the box.
Yeah. I was like, for the record, I'm not saying
know if it's gonna work.
I'm not treating erectile dysfunction.
Yeah.
I'm treating your lower back. And maybe
this
by
may work.
chance you might have better erections. And sure enough, it did.
I
that's
love
cool,
that
man.
mentality.
And that's awesome that you're going to eventually be able to bring in the red light therapy, the cold plunge. Are you going to be bringing it into your location?
So this location right here, the storefront is split into two. The woman next door, she moved out. And so I took over the lease next door so that now I own the entire store. Not own it, but I'm leasing the entire storefront. And I'd like to make the square footage that I have next door the same size as my office, a recovery area.
I have somebody I'm going to put you in contact with. We went down to Florida. We were in Clearwater, right around Clearwater, and we visited a friend of mine's gym. It's called The Gym. And next door, they had
Marissa and Nathan.
Yes, they had cold plunge, red light therapy. They had the whole 9, and they're crushing it.
Yeah.
I mean, I asked them, they threw around numbers a little bit because I'm a numbers guy. I love to know what's what, and they're crushing it. So I'm very, very curious to see how that's going to play out for you, because I think you're going to be very successful with it. Let's talk about marketing actually for a second. How do you, is this a referral based business, would you say, or do you do a lot of marketing?
A lot of marketing. I actually, before I even started Strive, I saw this one guy that I'd been following. He had a huge following at the time, and he shouted out his social media coach. And I was like, social media coach? And he tagged him. So I went onto this guy's page, and he's not a chiropractor, but he helps chiropractors grow through social media and helps them in all avenues. So I reached out to him, and he came back and he's like, let's hop on a call, try this free framework. So when he sent me his free framework, it was a 20-minute video, man. And I was sitting there taking notes. And I was like, okay, cool. I used it and I got like 100 new followers and I had like 15 new people that booked. And I was like, this is crazy. All stuff that I implemented on social media. He's like, cold call DM people. Anyone that follows you, just follow up. Hey, thanks for supporting my page. Try this content video where you display your, like, don't be talking to the camera, but just show the treatments that you're doing. And no one in Rhode Island was doing that at the time, in terms of like getting a videographer and putting like a rap song over a treatment.
No,
Like,
Yeah.
just making it catchy and
Yeah.
fun. And
Modern.
It's very
it
unique.
doesn't have to be like so.
Do you have a TikTok too?
I do have a TikTok.
Good.
Yeah,
Good.
I should be posting all my Instagram videos to TikTok.
Everything. Yeah.
But I
And you should
forget.
be going live on TikTok.
Yeah, that's a good one.
Going
too.
live on TikTok is huge. You gain massive amount of followers, and a lot of people that we've noticed that go live on that we meet live on TikTok, it translates to some type of business.
Wow.
Whether it's we write them a diet plan, or we're a coach for them in some aspect. The coaching world right now is on fire. It's if you can get with the right people, your life can completely change if you surround yourself with certain people.
Yeah.
And I truly believe networking, coaching. I mean, some of the top billionaires in the world, they all have coaches. They all have a fitness coach. They all have a business coach. You know, all that stuff is huge. So I commend you for being so on top of your Instagram, because that's honestly what caught my attention. You know, I saw your page, and it was actually Dave. He had recommended me to reach out to you about the podcast. And the second I saw your podcast, your Instagram, I was like, dude, this guy's going to be perfect.
Yeah.
Because we don't have just anybody on. There's people that reach out to me all the time. They're like, oh, I think it would be cool, blah, blah. I just have to have a personal connection. That's why I think this podcast has been working, because I just talk to people that I want to talk to. I do very little research into that person before they come on, because I want to get to know them in person.
Sure.
And that's kind of part of the uniqueness of what we try to do.
I like that. So I ended up signing with him.
Yeah.
And I stayed with him, and he just helped me continuously build my social media, taught me how to use Meta Business, which starting out can be tough. And when you're a one-man show, like when I first started, I didn't have an office staff up until about 3 months
You
ago.
did it all yourself.
I was the
Wow.
janitor. I was the
Did you have anybody? It was just you?
just me, man. I was doing the social media, all of the emailing to the lawyers or
Yeah.
MRI or any other clinics, referrals, the treatment itself. I mean, I was getting burnt out.
You do it.
I
I was going to say, you
bet.
do it for as long as you can until you're like, okay, I gotta
It's
source
worth
this
the
out.
money
Yeah.
to pay somebody for
That's
help.
exactly what I
Yeah.
did, man. I have 3 businesses. I have, like I said, the family. We have the podcast. We have another show that I'm working on. It got to a point where I was like, all right, I got to start building a team that sees my vision, that wants to be involved in everything that we're doing,
Yeah.
that wants to grow with us. And that's what you're going to end up doing. You're going to end up finding people and meeting people along the way, like us connecting, dude. If there's anything that I can do to help your business grow, I don't want anything, dude. I just want to see you succeed. I truly mean that. And that goes for Luke. That goes for Chris. I'm part of a project right now called Aura Light. Incredible project. It's a recessed lighting that has removable shades that you can dress up the interior of your room. It doesn't have to be just a flat recessed light anymore. You can put a shade up. You can put whatever you want. And I've been part of that project, for a while now, just wanting him to succeed. He invented the idea. He came up with this concept. And if it takes off, dude, he's my friend. We all do good. So that's, when you find that group of people, you're going to go from here to there.
There's a great quote that I live by on some of the things that you just mentioned. It's I give to you not so that you can give to me. I give to you so that God can give to me.
Mm.
And it's a quote that
He gives you what you can handle.
it's
At
I'm not doing something for you expecting anything in return.
Yeah.
I'm doing something for you and expecting that everything good just comes my way from giving that to you.
And it does. That the power of reciprocation is real.
Yeah.
It is real, man. If you help people in a genuine way, you're doing it in your own way, which is amazing. You're helping people. You're probably changing people's lives.
I
know you are.
It's
And
nice.
it's
You
nice
are.
that you're doing it on the opposite side of big pharma. You're
Yeah,
actually
yeah.
healing people with their own bodies instead of introducing medications, because people forget that these are still man-made drugs that you're putting into the human body, so it's not natural.
Yeah.
It might be temporarily fixing or putting a band-aid over your pain or your issue, but you're getting to the root cause of it and not having to. I love surgery. I love it because I'm interested in the inside of the body. But a lot of the things that we've done in surgery, you know that's not natural. And so it's amazing that you can
Wow.
actually have the fact that you can do surgery or not do surgery. You have to have both options.
Yeah. I love what I do, and I love that I do it well, at a relatively young age of 31.
Yeah.
And how I do it is just staying in my lane and being just good in that lane.
Yeah.
Because at the end of the day, you have doctors that you have MDs and surgeons and whatnot that are phenomenal.
Right.
And as long as they respect that my opinion for a certain condition is the right avenue, and I respect that theirs is the right avenue, great.
Yeah.
Some people have to go on those pills. Like I'm not anti-pharma. I'm anti just prescribing stuff when it's
Not needed.
misdiagnosed. My biggest pet peeve is being misdiagnosed.
Do you have a lot of people that come in
Absolutely.
on medications that get off of the medications because of the work that you've done?
Yes. Yep. So I had
That's
one patient that
special,
was
man.
taking a lot of meloxicam, which is a heavy anti-inflammatory.
Wow.
And she was doing it for her sciatic pain. And it was like, she's like, I have sciatica. Like, okay. So I'm asking all these questions, trying to get some information. And she's pointing down the side of her leg. And immediately I'm like, that's not sciatica. And then she's running me through everything that she's been doing. She likes to go on a lot of hikes. And it started off one hike that was more uphill than usual, and she slipped. We go into the physical examination, and it ended up being a muscle that attaches from her hip bone down to her femur, and it's the glute medius, it's the glute minimus muscle. So there's 3 glute muscles. You got the max, the medius, and the minimus. Minimus is the smallest one. The trigger point
I think
referral.
Sheena's just got one.
The trigger point referral pattern for that is down the side of the leg, just below the knee. She's like, it's sciatica. It just goes down. If I lift up my leg and I go over, it just shoots down. I'm like, look, this is what I believe it to be. I pull out my anatomy app. I show her the muscle. I show her the point referral pattern. And I'm like, this is what I'm going to do. She's like, needles. I'm like, just let me put 2 in there. Just give me a shot. Calls my office the next day. My mom picks up the phone. I hired my mom as my front desk now.
Oh, nice.
Only woman I can trust.
That's awesome, man. My
Yeah.
mom worked for me for a while.
Yep.
Yeah, that's awesome.
And she's like, can I please speak to him? My mom's like, she's like, please, I'll stay on hold. My mom interrupts me. I'm with a patient. I'm like, what's up? She's like, this lady's like really wants to speak to you. She's like, I'm worried. I'm like, give me a second. So I gotta speak to her, and she's just like, I need to see you next week. That's the best night's sleep I've gotten in weeks since it's happened.
Amazing.
And it's like, it's those little
Amazing.
wins,
It
man. I'll
is.
take
I
that.
know.
That's
I
a
know.
big win.
I always tell people I like to be I like my verbiage in my office to be very, very concise. I never give any promises, but I like to under deliver and over promise, if that makes sense.
Yeah,
Oh,
that's.
sorry.
I mean, that's what we do in our business.
Under-promise,
Under
over-deliver.
promise and over
Over-deliver,
deliver.
Yes.
And that's
Yeah.
what we do in our business. That's what you should do in any business. So
Yeah.
you're on the right track. I'm going to wrap this up with one question, and it kind of ties into everything. Do you ever feel like that you're part doctor, part coach, and part therapist?
Yes.
To be able to help people in that kind of way, and be there for them if they need to call, if they have a question. I mean, it just seems like you're on an awesome path. I love your content.
Thank you.
Everything that you're doing, man, you should be super proud. You're 31 years old.
Just turned 31 September 10th.
I mean, what you're doing is amazing. If you want to follow Dr. Mike, follow TheCombatChiro on
Mike's fine.
Instagram.
How do you keep yourself balanced? You noticed, or I mean, you said in the beginning that you have gone back to church, which is one way that you probably alleviate your own personal stress. But how do you? I mean, because you're taking in a lot of people's energies just by
It's
taking
very
in their
exhausting.
pain.
Black
It is
coffee.
exhausting. Yeah.
Yeah.
So other than black coffee and getting back into your spiritual side, how do you find your own balance?
There's a few things. One is just having a really grateful mindset. I think waking up every single day, knowing that you have this great purpose and looking and seeing how much better you have it than other, like it's cliche, but like you see some people have nothing. And then
Yeah.
here I am. I have a great family. I have great siblings. I have a mom and dad that are still together. Like I'm already in the top 1% right there.
True.
Pair it with, I have a business and I have people that come to me and I make an income. I just say you're blessed, and I wake up every day and I have a place to go to and
Yeah.
a place that I can work and do my own thing. Like I'm my own boss now, like, which is great. Like I worked so hard in school, and if I look back at school now to me graduating, I would have never seen this. I promised myself I wanted to practice in 5 years. I did it in 2. Like that's,
Wow.
You know,
Good for you,
incredible.
man.
but just knowing that if you just wake up every single day and you have a positive mindset and you take care of yourself, You exercise, you have whatever mental stimulation you need in terms of keeping yourself grounded. I think that's just what helps me. And of course, and then you just start adding, like I have the coaching business now. I have a few clients that I teach to start a cash
good.
practice.
Good.
I have the olive oil, which I do with my brother, which,
Yeah.
oh my,
You know what? Thank you for bringing
Yes.
that up.
Yeah.
You were gracious enough to bring in your olive oil. So how do you pronounce your last name?
Georges.
George's. I thought so. Okay. George's Family Extra Virgin Olive Oil in loving memory of your father, Nahib.
Father Najib Georges. So
Najib?
because he was a priest, that's my grandfather.
Okay.
So Father Najib Georges, yeah.
So this is made in Lebanon?
This is made in Lebanon.
Wow.
Cold pressed in Lebanon, shipped over here.
So what's the process like making olive oil? Like what goes into this? Is it a lot of work?
So nostalgic. We actually hire workers over there. Like, so I go there and I oversee it, and I'm in the fields with them when I can, when I'm able to go. But essentially what they do is they lay down tarp and you get the olives off the trees. Now from there, we have a guy that we work with that the surrounding cities work with. You take it there, the machine runs the olives up, it cleans them, and then it grinds them, and then it juices them completely using a cold press machine. And then it looks so perfect.
And
They give you a little snifter to try it, and I mean, it's
Wow.
liquid gold. It looks like gold coming out.
That's literally all it is, just squeezed olives.
That is pure, nothing added,
Incredible.
bottled by my brother and I.
Can we buy this anywhere?
Yeah, in my office.
Okay, good.
Yeah.
Well, we're gonna be setting up some appointments, so we'll get some olive
We're
oil
looking
too.
we're looking to get it in a few like small markets, like so I know there's Sonia's over on
Yes.
Park Ave.
Yes.
I'd love to get it.
Yeah.
I've actually spoken to Ari. He's like, I want to sell it in my
Yeah,
market.
that would do very
Yeah.
well there. Where can people find you?
So socials, you can find me. You can follow me at TheCombatChiro. I call myself TheCombatChiro because I started working with MMA athletes out of Gary's gym.
Nice.
So the transition between my last job and starting Strive was Gary was just letting me treat members of the gym, and that's how
Cool.
I started treating some of the fighters there. So I was like, all right, and I do jujitsu and boxing, so
That's awesome.
Combat Chiro in there.
And where's your location?
Office is 1675 Cranston Street.
Cranston
They
Street.
can find me there and follow me at the Combat Chiro on Instagram. And
Thank you for coming on.
I appreciate you guys
Yes.
having me.
Dr. Mike, it's been an absolute pleasure. And, down the line, we'll do a part 2 when you got your second place up and running, because I have a feeling you're going to be doing good things, man. And
I appreciate that.
very, very much looking forward to it.
Thank you.
Thank you for coming on.
Thanks for having me, man.
Awesome.
Seriously.
Awesome.
Thank you, Sheen, as well.
You're welcome.
Appreciate it.